Hello everyone, I'm Divya. I'm currently pursuing my M.Pharm in Government College of Pharmacy in the Department of Pharmacology. And today I'm here to discuss a topic on active and passive surveillance under the guidance of Anita ma'am. The content we are going to discuss is introduction to surveillance, types of surveillance, method of collecting data, importance, conclusion, and next reference. At last is a reference. So, what is the meaning of surveillance? We know surveillance is nothing but a monitoring the behavior, our activities, our information for the purpose of information gathering. And coming to the exact definition of surveillance in the pharmacovigilance is that surveillance is the ongoing systematic collection, analysis, and interpretation of health data essential to planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of this data to those who need to know. So, example of the pharmacovigilance surveillance is communicable diseases, health behavior, environmental risk, and disease healthcare. We know disease surveillance is a systematic collection of analysis and a dissemination of data on disease of public health importance so that appropriate action can be taken to either prevent or stop further spread disease. And it guides surveillance is also guides the disease control activities and measure the impact of the immunization services. So historically, surveillance were used to monitor the infectious disease, chronic disease, injury, health service uptake, and vector distribution, environmental hazard. So surveillance is main force is a high-end ear of the public health. The information of the surveillance can be used as a characterizing the pattern of the disease, detecting the epidemic, further investigation the research, and disease control the program, and setting the priorities and education about the disease. And some of the few basic element which comes under the surveillance is first we have to detecting the health events and notifying them first. Then it is done this notifying events it is done by health service at the laboratory. Then the information is collected and stored in a system. Then this information is analyzed and interpreted. Then this information should be reached the right people and appropriate action should be taken. Next we see the types of surveillance. There are many types of surveillance: passive surveillance, active surveillance, syndrome surveillance, rumor surveillance, and sentinel surveillance. Here we are particularly focusing on passive surveillance and active surveillance. Passive surveillance is nothing but routine reporting of the health data. For example, in some countries, the disease should be notified by the law. So, surveillance of the disease mostly depend on the passive system. For example, is registration of disease, collection of the birth, death, cancer, chronic disease, etc. So another example of we can take is hospital data, health data. So number of type of patient for the treatment. Collecting this is also comes under the passive surveillance. And passive surveillance is a valuable source of the health information. And it involves a passive notification by surveillance site, and reports are generated and sent by the local staff. And passive surveillance mainly relies on the cooperation of the healthcare provider, laboratories, hospitals, health facilities, and private practitioners to report. Then once the data have been received, they must be complied and they analyzed to monitor disease pattern and identify the possible outbreak, and involves the regular collection and reporting of surveillance data, and it is a commonest method. And coming to advantages of the when we see the advantages of passive surveillance is it's low cost, baseline data can be collected, we can monitor the trends and monitor the impact, and also different set of the data can be linked for the complete information of the health. uh, when coming to the limitation, reporting under reporting, because many people have mild asymptomatic illness and lack access of treatment. There may be laboratory facilities to diagnose the disease may be inadequate, and maybe logistical issues, and there may be also a lot of variation in the country to country which reflects social, economical, and epidemiological factor. However, because it relies on the extensive network of the health worker, it can be difficult to ensure the completeness and timeliness of the data. So in some countries might not have a capacity or the resources to identify all the cases or disease, either because the diagnosis of the disease requires specialized clinical skills or because the laboratory resources are not available throughout the countries. In such cases, passive surveillance is helpful. Coming to the active surveillance, in active surveillance, health data is actively sought out. That is, this the type of surveillance is mainly carried out when there is a outbreak. For example, during outbreak, health team visit the community to actively seek out the cases. So another type of active surveillance is the zero surveillance, where the testing blood is in the selected population for the various marker and to check the antibodies for the active or passive disease. And health service is also a good example of the actively seeking out the health information surveys can be done on the community health centers or entire country. So it can also be done on the needed basis or regularly basis. So active surveillances provide a complete and better quality data and resource are intensive, and some of the important tool of this active and passive surveillance is ProMed and global public health intelligence. And in ProMed and Global Public Intelligence, this is an online tool where they provide about the early information of the disease. And it is active surveillance is more difficult to set up and expensive to conduct. And does not replace the passive surveillance but complements it. If conducted regularly, it has the following advantage, that is helps to improve the timeliness and accuracy of the case detection and reporting, and enable the rapid case and investigation, including taking laboratory specimens. It closely linked to the laboratory system through individual case identification, enables timely action to be taken in response to the detected cases. So coming to the difference between active and passive surveillance is population under surveillance. In passive, we'll see about whole country. In active surveillance, all cases attending in a selected health facilities. Coming to the advantages of the passive surveillance, can provide accurate rates and data on burden if reporting is complete and supported by the reliable laboratory result. In active, rapid detection of outbreak. Disadvantages needs extensive clinical laboratory resources. Reporting is rarely complete and timely, heavily demand on data management, whereas active surveillance resources are intensive, requires dedicated staff report and management. So why is surveillance is important? Surveillance is important to monitoring the disease trend, describing the nature history of the disease, then identifying the new syndromes, and monitoring the changes in infectious agent, planning about the public health policy, and identifying the areas of the research, and monitoring the obesity, physical activity, and other indicator for the chronic disease. Why is disease surveillance is necessary? Because to predict and detect the disease outbreak with a view to investigate and contaminate, to identify the high risk population and area requiring the special attention, and monitor impact and progress towards the disease eradication, elimination, and control, and identify the areas in which the system performance is poor so that corrective measures can be taken. And it also identify the circulating strains including genotype and subtype, and determine the frequency of occurrence of the disease in the community and the burden of the disease. So importance of the surveillance is collecting the data in nearly one step, and critical goal is to control or prevent the disease. Any data collected must be organized and carefully examined, and any results need to be communicated to public health and medical communities. So, how to conduct a surveillance is surveillance should data allow prescription and comparison of the patterns of the disease by person, place, and time. And will concentrate on simple technique, and data by geographic location can be presented by the table. And coming to the example, we are looking for example, when we take a streptococcus pneumonia, the common cause of community acquired pneumonia and bacterial meningitis, examining the distribution of case by the race. Which important information about the burden of the disease is different population. Here the data collected on the based on the races, that is due to the streptococcus pneumonia. Whites have 2,614, whereas black have 1,095, and others have only 213 cases are reported. And data shows the majority of cases reported among the white. And can draw only limited conclusion because race not record for 684 cases, and shows only a number of reported cases, not rate. Total number of individual by race needed to determine if there is a disappropriate burden of the disease among the races. Data presentation and the surveillance data must be presented in a way that is easy to understand and interpret. So many ways is to display the surveillance data, that is line graph, maps for presenting data as geographic context, and graphical displays such as histogram, frequency charts, stem and leaf display, are single or multivariable tables. The choice of particular graph or table depends on the type of data that present, should be simple and easy to flow, and should provide all information necessary to interpret the figure without referring to that context, and note any data exclusion. So include a concise title that describes subject or disease, time, place, and define any abbreviations as symbol. For example, when we take Salmonella typhi for 2 years, that is from intervals 1974 to 2002, the spike here you can observe is that spike here in 1994, indicating the outbreak of Staphylococcus typhimurium, the obvious without the quantitative analysis. So coming to the conclusion of the surveillance is a valuable tool that can be serve many purposes, and when surveillance data is analyzed, interpreted, and reported appropriately, this data can provide important information about the disease pattern to inform the public health and practice. Coming to the other types where we discussed about passive and active surveillance. Other types is sentimental surveillance and rumor surveillance. In sentimental, the selected institution or group to provide a health information or data. So it can be used for monitor the disease or trends and detect the outbreak. But it is unable to detect the outside site or group because it is dependent to a particular site and a particular institution. Whereas coming to the rumor surveillance is rumor because of we know the rumor meaning of the rumor, that is due to the discussion site, media, and the way, year, and say and through social media, and alert authorities and